If a flight of stairs worked as a medical treatment, we would call it a breakthrough. Today we look at 4 recent studies that make ordinary things, stairs, family choices, social cues, and asking for help, more consequential than they first appear. We begin with a new state-by-state map of child-free adults, then examine an experiment on how sexual arousal changes the way men read flirting, then unpack a meta-analysis on stair climbing and early death, and finally explore why many male survivors of intimate partner violence do not seek support. The connecting theme is that personal decisions and health risks are shaped by individual traits, immediate mental states, and the surrounding environment. The first study, published in PLOS One, asked where child-free adults, defined as people who do not have children and do not want them, actually live in the United States. Researchers from Michigan State University used an online survey of 20,118 adults collected between late August and early October 2024. They estimated that 22% of adults in California were child-free, followed by Michigan at 19.9% and New Hampshire at 19.4%. Louisiana had the lowest estimate at 9.4%, with North and South Dakota at 10%. That is a more than twofold difference between California and Louisiana, the comparison that drew widespread attention. This population is not static. According to the National Survey of Family Growth, the child-free share of non-parents aged 15 to 44 rose from 13.8% in 2002 to 29.4% in 2023. The new study is mapping a growing group that is often missing from policy debates about family, housing, and aging. Yet the authors found that state context was not the strongest predictor. Child-free adults were more common in highly populous, high-cost states, but the estimates did not cluster into clear regions such as the Northeast or Southwest. Instead, individual demographic characteristics, being single, older, and male, were better predictors of being child-free. That means the map likely reflects the distribution of people with certain life circumstances, rather than something uniquely causal about California or Louisiana. This finding carries a policy warning. If states assume that local conditions drive childlessness, they may overestimate how much pro-natalist policies can change fertility. The authors argued that state-level policies to encourage population growth are likely to have limited effectiveness. However, the study has clear limits. It offers state-level resolution, not neighborhood detail, and it cannot prove why people live where they do. Some child-free adults may move to states that match their values or budgets, and self-reported fertility intentions can change. Stronger evidence would need to follow people over time and test whether moving to a different state changes their plans. For now, the practical takeaway is that 1 in 5 adults in some states are child-free, and public conversation should not treat that as rare or temporary. From long-term demographic patterns, we zoom into a much smaller timescale, a few seconds of social judgment during flirting. The second study, published in Archives of Sexual Behavior, tested how sexual arousal changes the way men decide whether a woman is flirting. Psychologists distinguish between global cues, which are broad and stable, like revealing clothing or overall attractiveness, and specific cues which are immediate and person-directed, like a smile, scowl, or direct eye contact. Over-reliance on global cues means focusing on sexual appeal while ignoring direct signs of rejection. Researchers recruited 284 heterosexual men for an online task. Participants viewed pairs of photos of the same woman and had about 2 seconds to choose the image where she was more likely to be flirting. The photos varied by clothing, from casual to sexually provocative, and by facial expression, from flirtatious to rejecting. In low-conflict trials, one photo showed a flirtatious woman in revealing clothing and the other a rejecting woman in casual clothing. There, cues aligned and accuracy stayed high. In high-conflict trials, the choice was between a casually dressed woman who was flirting and a provocatively dressed woman with a rejecting expression. The correct choice, based on facial expression, was the casually dressed smiling woman. After a baseline round of 52 trials, men listened to a 5-minute explicit erotic audio narrative and then completed another 52 trials. Arousal made choices faster in both conditions, but accuracy only dropped in the high-conflict trials. In those trials, men became more likely to select the provocatively dressed woman who was rejecting them and to bypass the casually dressed woman who was actually flirting. A subgroup made errors on at least half of the high-conflict trials when aroused. The effect was strongest for men scoring high on sexual manipulativeness, exploitativeness, disinhibition, and sexual entitlement. Arousal appeared to amplify pre-existing perceptual biases rather than create them from scratch. This does not show real-world misconduct. It is a controlled keyboard task, not a dating scenario, and the authors note that fatigue could explain some late-session errors because baseline always came first. The sample was also Western and internet-based, so the results may not generalize everywhere. Future research could counterbalance the order or test other arousal states. Still, the finding has practical value. If arousal shifts attention toward clothing and away from facial rejection, then education about boundaries may need to train people to prioritize direct person-specific signals, not just general values. From a temporary internal state influencing perception, we move to a repeated physical choice, influencing long-term survival. A systematic review and meta-analysis from the University of East Anglia and the Norfolk and Norwich University Hospital examined stair climbing. The team reviewed nearly 1,900 studies and pulled data from 9 high-quality studies, with more than 480,000 participants. The median follow-up was 14 years, and the sample included healthy adults and people with a history of heart problems. Ages ranged from 35 to 84, and 53% were women. The headline result is that people who regularly climbed stairs were 39% less likely to die from heart-related problems and 24% less likely to die from any cause compared with people who did not climb stairs as often. They were also less likely to develop major cardiovascular conditions such as heart attack, stroke, and heart failure. Cardiovascular disease is the world's leading cause of death, with cases nearly doubling between 1990 and 2019. Stair climbing is appealing because it can be inserted into daily life without a gym, special clothing, or a large time commitment. Previous research cited in the study suggests that even minutes of stair climbing several times a week can improve fitness and lower cholesterol. One large cohort study suggested that around 6 flights per day may provide the greatest benefit, but the optimal dose needs more research. As with the earlier findings, these are associations from observational data, not proof that stairs alone cause the lower death rates. Stair climbers may differ in other ways, such as walking more or having fewer mobility limitations. The researchers also caution that stairs are not suitable for everyone, especially people with joint conditions or mobility impairments. Future studies could use wearable sensors to measure stair use more precisely. The practical takeaway is that if you have a choice between the stairs and the lift, the stairs appear to be a low-cost, meaningful option for heart health, especially when buildings make stairwells visible, safe, and inviting. The final study shifts from physical health to the barriers that keep people from seeking support. George Mason University researchers examined why men are less likely than women to seek help after intimate partner violence. According to the Centers for Disease Control, 44% of men report being victims of intimate partner violence, yet many do not receive help. The team analyzed a large U.S. sample of non-Latino Black, Latino, and non-Latino white men reporting female-perpetrated intimate partner violence. Across all groups, the most common barrier was viewing the abuse as a private matter. Men also reported fear of retaliation, shame, and concerns about not being believed. The differences between groups matter. Latino men were more likely to report shame or embarrassment as a barrier. White men were more likely to say they had difficulty labeling their experiences as abuse. Black men were less likely to report concerns about not being believed. These nuances challenge any one-size-fits-all explanation. The authors argue that support services need to be trauma-informed, culturally responsive, and gender-inclusive. If privacy framing is the biggest barrier, public messaging may need to directly challenge the idea that abuse is a private matter. If shame operates differently across communities, materials may need different language. This study is based on self-reported barriers and 3 broad racial or ethnic categories, so it cannot capture every experience. It also focuses on female-perpetrated violence, not all forms of intimate partner violence. Still, the practical implication is clear. Male survivors exist in large numbers, and the reasons they stay silent are not uniform. Taken together, these 4 studies show how context, individual traits, and temporary states interact. The Childfree map found visible state differences, but individual demographics predicted status more strongly. The Arousal experiment found that a short-term state changed which social signal men prioritized, especially in those with certain traits. The stair analysis linked an ordinary physical choice with substantial long-term survival differences. And the intimate partner violence study showed that barriers to help are shaped by gender, culture, privacy, and shame. None of these findings offers a simple lever, but together they suggest that better maps, better perceptual training, better building design, and better support services could make meaningful changes. Here is the thought-provoking question. Which everyday signal, a stairwell, a facial expression, or a help-seeking cue, do you think we are currently misreading most often? And what would change if that environment were redesigned? Please subscribe for more daily science content.